Right, let's get you started with that conversation about anxiety that we promised you this morning, because this is a word that it gets thrown around every now and then. But what does it actually mean, and at what point does anxiety, which would ordinarily be a normal thing in a human's body, become a disorder and a cause for concern and something that you need to seek professional help for? This is what we like to answer, and all those questions are coming up shortly. But we want you to be part of this conversation. That's why we ask you on our question of the day, have you ever experienced an anxiety attack before? Have you ever experienced an anxiety attack before? And what did you do to calm yourself down? You can send that feedback on social media at NTV Kenya and at Victor Kiprop _ use the hashtag #NewNormal so that we can see the tweets that you send us. And if you're not on Twitter, you can be on Facebook and YouTube, where we're also streaming live, and you can send that feedback there. If you're not on social media at all, you have a mobile phone, you can call in on the numbers which will be below your screen in a short while. But for now, allow me to introduce my guest this morning, Dr. Priscilla Macau. She's a psychiatry resident at the Mathari National Teaching and Referral Hospital. Good morning. Good to see you.
Good morning.
It's been a minute.
I know, right?
Welcome back.
Thank you.
All right. This is a word that is thrown around. Anxiety. Oh, God, I'm anxious. There's a lot of anxiety. I can't wait. I can't do this and that. But even before we get to disorder, let's just, on the basics, define what anxiety is.
So anxiety, the feeling anxious, is normal. It's when you have worry, you're feeling like something is wrong, you're just fearful. So that is normal, and this everybody goes through it.
A proper bodily reaction.
Yes, anxiety is a normal body reaction when you're faced with things that you're scared about. So that is completely okay. Now, it becomes a disorder when it affects your day-to-day ability to live life. Then now there's a problem, because now you're worrying too much. You cannot be productive in the society. You can't do your day-to-day things. You have to avoid certain things in life. And it also comes now with physical symptoms that are persistent.
Okay.
So you have worry. Maybe, for example, you have to go for a job interview. Then you worry. That's fine. But then when it's persistent, you keep on now worrying. You're like, am I going to really do well? All the time, and it takes time. It's as a persistent worry that does not go away. Okay. And because of that, you end up having physical symptoms. So you have like your palpitations, meaning your heartbeat is really fast, or you're sweating, or you're twitching, your eyes are twitching, you're just not able to function on a day-to-day. Then now that becomes a problem.
And I'll definitely come back to the physical symptoms and the emotional behaviors, but on that bit about the normal bit of it, am I allowed to be, let's say, anxious about an exam that I have not well prepared for?
Yes, it's normal. It's because you're always anxious about things you don't know, because you don't know the outcome and you don't understand how it's going to be, right? But now when it's persistent is when there's a problem. Where now you'll be like, I'll never do an exam again, because every time I want to do an exam, there's something wrong. That means you're not going to proceed in life. You're not going to do well, So that now it hinders your productivity. Then now it's a problem. But the normal anxiety, that's fine. Like if you're going to work, for example, and then you're in a jam, you're definitely sure you're going to be 1 hour late. You're going to be anxious. You're going to be, worryful. Oh my God, I'm going to get fired. That's okay. But now when you get to work and then you're still thinking, oh my God, I'm going to get fired. But you're already here and you're working and your employer hasn't said anything. Why are you worrying? That's done. Yeah. So you don't need to go back there again. Yes.
All right. So that means it's fine. I can sweat. I can do what? I can do everything I want, as long as it doesn't manifest in the long term. All right. Let's talk about when it now becomes a problem.
So when it becomes a problem, as I said, you cannot do your day-to-day activities. So for example, let me pick someone who maybe has panic attack, for example. So it's okay for you to feel like your heart is breaking, you feel like something is wrong, it's an unexpected thing, it happened once, that's it. But now people with panic disorders, it keeps on recurring. So they're scared. Oh, every time I go to the supermarket, something happens. I will never go. You see?
Oh, okay.
So it will stop your normal day-to-day activity. Yeah? It will hinder it. Or even social anxiety. You're told, like people with social anxieties cannot be on TV, for example, because they think, I will go on TV and then they will laugh at me because I will stumble and fall, or I'll forget my lines. So maybe they're really good at journalism or, you know, mass comm or something, TV
Yes.
production, but they're not able to do their work because of the anxiety.
So you can be the best public speaker in town, but anxiety can just beat you off. Every time you think of going to the stage, unaanza ku...
It just goes away. Your lines disappear and they never come back. Literally, never come
Is
back.
this why we prepare sometimes to deliver the speech has been prepared by 3 assistants. We have gone over it 5 times through the night. But when you get there, unashanga huyu mtu si tulimprepare enough.
Yes, and they won't talk. But now, you see, that day, when ideally you should overcome it. You should stand there and then you're blank for like maybe if your crowd is good enough, it will give you time to just overcome the nerves and actually just start talking.
Okay.
But then if it's a series of events and then you actually now avoid, you'll end up, you see in life, you always avoid things that don't make you happy. So you end up avoiding those situations. So what happens? If you're told, oh, you need to go, maybe you're a musician, you need to go and sing. And you're like, I can't. I can sing in the bathroom, but I cannot sing in front of people. So you're wasting your talent, literally.
I feel attacked about the bathroom thing. Okay.
I didn't know. Maybe we should look into it.
But really, how does it manifest then in me? How do I know that, well, now my anxiety is starting to become a problem, especially the physical part of it?
Yes. So now you've said already you have the worry. Then you realize that you think about it.
Too much.
Too much. You're like, you're told, take a taxi and go to town and buy us, or go to the supermarket and do some shopping. And the thought of just getting out of the house into that taxi, you start now having, your heartbeat is increased, you feel like you're going to die, you feel like this is not a thing that I should do, you try looking for corners, so that you don't do the thing that will expose you to your trigger. You get? So, and you're always there, so that already, as long as it is impeding your day-to-day activity, as long as it's your productivity is being curtailed and affected, and then now you're having your heart rate, you're sweating, you're not able to move. Sometimes they're trembling. Sometimes they just want to go into a corner. They cannot breathe properly. The shortness of breath is a lot. Then now you're like, okay. And then it keeps on recurring.
Is this why sometimes you see people pacing up and down?
Yes,
they're
trying to calm themselves, but it's not working. And then it keeps on coming back. You see, in mental health disorders, we usually say it's a recurring. Most of them, they're not like one-off. Recurring. They have to keep on repeating. And so we have time ranges. So with the different types of anxieties, you can have maybe 6 months, you can have a month, depending on the range and the diagnosis you're going to be given.
Okay.
Yeah.
I like that you mentioned something about types. Can we go over the types then?
Oh yeah, there are several types, so we can try and go over some of them.
Yeah.
So the one I was saying, like over a period of time, so there's one for 6 months, where it's the general anxiety disorder, where over a period of 6 months, when you look back, you're like, there's been something I'm supposed to do, but I'm not able to do it because I get this worry, I tremble, I'm restless, shortness of breath. For a period of 6 months, I'm not able to go to work, or when I go to work, I cannot fully function, you know? So you're like, there's a problem. So that one is general anxiety disorder. It's just a general, we don't have a specific thing that you're
you're anxious about. Okay.
Right? Then there's the one that where you have specific things, like the people who fear spiders, for example. I know, right? So you have people who fear spiders.
I have someone in my life who fears chameleons. Anyway, I'll tell you that story.
So yeah, they have the fear, and you can imagine they are not going to go near like a tree, because in their heads they're like, this tree, there might be a chameleon here that is, it's brown, and this tree is, I cannot go there. So they, anywhere where there's any type of tree or any, they seriously avoid, even if it means that is where they would have gotten the better production, work production and stuff, they will not go there. So now that is a specific type of phobia. Then, as we said, there are those ones who will not be able to leave their houses, the social phobia, and also the ones who anxiety because of social places, as we said, they cannot be able to speak, as social anxiety. Then you have the panic. I think many people get panic attacks, and they are worried it might be a panic disorder. So the attack happens once. It's a very sudden onset. It comes very fast. You feel like you're dying. You cannot breathe. Your heart is beating very fast. You're like, oh my God, I'm going to die. Now that's an attack. It comes after 10 minutes or so, it goes away. Then you're saying you're pacing around, you calm yourself, it goes. But now, a panic disorder, the patient is always thinking
about
that
something.
they are going to get the panic attack.
Okay, let me get this straight. You have a panic disorder, and this disorder involves
a panic attack.
Worrying about a panic.
Yes.
Okay.
You're always just like, oh my God, oh my God, oh my God. Now, and you know, when I go there, I'm going to get a panic attack. I'm going to, so you don't go. Because the idea of most of the anxiety disorders, you will avoid the thing that is making you anxious. So the panic attack, you will always be thinking, I'm going to get a panic attack for the panic disorder. So you're like, this is not going to work for me. So now you get the disorder. And the attack usually is like 10 minutes, it goes away. But now it keeps on repeating itself, and then you keep on thinking about it, so you keep on repeating, so it becomes a panic disorder.
You mentioned something about social gatherings and whatnot. Does this happen even in adults?
Yes. The one that actually the social, of course, it starts when maybe children are small, they are shy. You're like, this one is just a shy child. But maybe that's how it is starting. So ideally, you should actually help our children to be able to talk more, to be more vocal. I know this generation is really trying to push our kids to be as vocal as possible so that they can be out there and experience different types of things in life. So there's that. Another one that I know many people might have seen is the post-traumatic stress disorder. And that one is after an event. So you have a traumatic event. People know refugees because of war-torn countries. But as simple as the home setup, when you have children who've been brought up in domestic abuse setups, you find any time that there's some form of clap or some form of noise, they are startled. Because they're like, I need to run. Because, you know, one of the things of anxiety disorder is you will flight. You want to go away. Yeah? So anytime you hear a boom, you're like, it is time to hide under the bed. It is time to run. So people who've gone through areas or families that have gender-based violence or some form of violence in the house, they also have, if they keep on persisting and persisting, they'll have some form of PTSD. Okay.
And you mentioned the triggers back then, and I guess this is where the traumatic issue comes in. So are there things that even if you are just doing just fine, like we're having this discussion right now, and it triggers you and you go completely off? Yes.
Especially because, you see, the mind has kept a record. Yeah, because that's how post-traumatic stress disorder works. Something happens in your life and you're like, it's like even an accident, for example, like for the bomb blast that happened in 1998. So you can imagine someone who was in that blast and maybe did not get help because, you know, we're not really big on psychiatry and psychology and therapy.
Especially back then, it just wasn't there.
Exactly. So someone did not get help, but every time that they hear a tire burst, that's it.
Okay.
They stop driving, they park on this, because in their head, they just keep on remembering now. They're like, oh my God, there was that blast. And then now when they go to sleep, they think about it. They're having nightmares about it. They will avoid going anywhere near any type of noise. So you see that it's coming back. It's a traumatic event that gave you a disorder.
Okay. But this is for really traumatic events, like you said, the issue of the bomb blast and whatnot, and sometimes being in situations where there's like active shooting and whatnot. Do we have it even for smaller issues? I mean, the reason I'm asking this is, at one point in my life, one of the 3 times, this is a joke, the times I've lost my phone, it was because it was snatched by someone who was on a motorbike. And nowadays, if it's at night or late in the evening and a motorcycle is coming from behind, I just find myself clutching to my phone.
So the fact that it's not affecting your day-to-day activity, you're avoiding it because that is how normal human beings, that's how it is. I mean, you cannot see danger and go back, you know? Yeah, but if it was now, maybe you need to do a show at NTV at like 10, and I know you live here maybe at 12. You know, when the show ends and everything, you take some time before you leave the studio, and then you reject the offer. Like, I cannot do prime time.
Oh, ama mimi sitakuwa natembea na simu tena.
Yes, you know, I will never be out at night. I will not be doing prime time. Then now you see it is affecting your life.
Okay.
And usually, normally, when the traumatic event happens, for example, if there's a break-in in a house or something, you usually, for the first month or so, everyone is very cautious. that's a normal reaction. It's not PTSD. It's very normal to always check your doors if they're locked. To check, you know, because you're like, oh my God, najua mlango wazi and a thief came, you know. So it's a very normal thing. But now it becomes a disorder when it's now like for post-traumatic stress disorder, after 1 month, you're still reliving it. You're still dreaming about it. You're still avoiding the things that were there. You're still startled by anything that is near. Then now that becomes a disorder.
Okay. And I was researching about this and I ran into something called generalized anxiety disorder.
Yes.
Do we have people who constantly worry about everything? I'm going to fail in life. I am not going to pass these exams. Like you're expecting the worst outcome out of everything.
And then they call you a pessimist. Yes, they are there. So there's a pessimist, but now there's someone who has a disorder. There I said that general anxiety disorder is just, you don't have a specific thing like your friend is scared of chameleons. I know someone who's really scared of snakes. It's just always, everything. They're just worrying day to day. But you see, the thing is, with a mental disorder, it has to affect your day-to-day productivity. Yeah, and you have your physical symptoms, and it is not because of something else. It's not because you went somewhere and ingested some things and then they made you anxious.
Yeah.
For example, there are people who go and ingest some drugs and they become very paranoia and all. And then after the drug is out of the system, they are good. So you see, it's not because of that. It's just a general thing that happens on almost day to day. And for GAD, general anxiety disorder, you look back for about 6 months, this thing has been happening.
Okay.
So now it becomes a disorder.
Okay. Now that we understand the basics of anxiety, have you actually experienced an anxiety attack or a panic attack or anything like that before? What did you do to calm yourself down? That's what we're asking you this morning. You can call in. The numbers are on our screens right now, the bottom of our screens. You can call in and tell us your experience. You can also send that feedback on Facebook, Instagram, or YouTube, where this conversation is actually streaming. You could also send that on Twitter at NTV Kenyan at Victor Kiprop _ use the hashtag #NewNormal so that we can see all the tweets that you send us. But really, moving on, Dr. Makau, then, do we have people who are let's say, at more risk of suffering from anxiety?
So the risk factors are there. For example, if you, for any of your family members, especially the first relatives, so that's your parents or your sisters, anyone of your family members who has been diagnosed with anxiety disorder, that increases your risk.
So there's a genetics bit?
Yes. Okay. Kindly note, increasing risk does not mean you're going to get it. Like, you know, you drive badly. You drive at 150 kilometers per hour. It has greatly increased your risk of getting into an accident and having a fatality. But that does not mean it's going to happen, right? We know people who are driving very badly and they are just surviving. And then wale wa 60 kilometers. So you understand my point, yeah?
Okay.
So it will increase your risk of getting this. And then, of course, the exposure. If you've been exposed to those harmful situations, as I said, people who've been exposed in gender-based violence, homes, or people who've been exposed to traumatic events, then your risk goes up of getting an anxiety disorder. There's also another disorder that people rarely talk about. It's called an adjustment disorder, where you move from one place to another. You know, you moved jobs and you just cannot seem to fit in. You're very anxious about it, but it goes away. But now, before it goes away, and it causes you not to work, that's adjustment disorder. It's actually something that many people overlook, but it happens. Yeah, I know of cases of maybe like you move houses. You know how the military used to move? They're moved from places to places to places.
Yes.
Then nobody, you know, funny thing, nobody asks the children how they're doing. So they move and they cannot cope. And what happens? They decide to just shut themselves out. From the universe, and that's one of the things that can happen. Yes.
I want us to talk about, so even on that same issue of the risk factors, when it comes to gender, do we have like another gender that's...
Yeah. Worry. Who worries more?
I don't know. I don't want to assume.
Most females are always, I think guys just have this thing for, things will sort themselves out. Most females are like, we like planning, you want to know what's going to happen, you're always worrying and worrying. So the fact that we are mostly worrying puts us at a high risk and, you know, to get an anxiety disorder than males.
I'd argue that for men, we worry, but we try not to show it that we're worried.
Maybe society. No, society just tries to tell you should be a man about it. But ideally, in a normal situation, even like if you're going somewhere and you're late, chances are it's the lady who just be talking and talking and like, you're so late. But the guy is just like, okay, we're late, so you know, next. We're gonna get there when we get there.
Yeah.
So yes, most women are affected more by anxiety disorders than the male gender.
Let's talk about children. Do we have anxiety in children, among
Yes,
children?
it is there. It manifests differently. So, you know, an adult can express themselves. You can see them talking, you'll see them maybe pacing up and down. Children are not really in, like, to be able to express themselves and tell you what's happening. So most of the disorders in children are manifested, there's something like art. You tell them to draw something.
Yeah.
And then when they draw is when you get to picture what they're going through. So they will not be having the complete symptoms like an adult. You know, they won't tell you, my heart is beating fast. They don't know what that is. But they'll be scared. They will hide. They'll run around. They'll totally avoid whatever it is they're supposed to do. So, and if they're forced to do it, they're crying. You find that child is always on the edge. You don't understand what's happening. Maybe they have an anxiety disorder and they should be seen by a child psychiatrist.
Okay. But sometimes we just brush it off and say, mtoto anakuanga mwoga, si kama ule mwingine.
No, there's how a normal person, like how just the personality of the person, yeah? That's fine, yeah? But when it's now excessive, they don't want to go to school. Maybe they got into a school bus accident or something, and they vowed they will never get into school. So this, like after 3 months, you're like, okay, maybe the child has forgotten. And you put the kid in the bus and they will not go. They're always sick the day for the bus. You're like, okay, but when you drop them to school, they seem to be okay. And then their grades are affected. After that accident, they never recovered. You know, because the kid is thinking about it. They won't come and tell you, I'm thinking about the bus. The child will just be seen to behave normally, but in real sense, the child is suffering.
Okay.
And so we need to take our children, especially after some events, we need to take our children for therapy. I think that's one angle that even during grief, when people pass away, I think we really ignore children. We tend to believe they are not seeing or they don't understand, but children have feelings and it really affects the adults that they are going to become. So it's good for them to go for therapy so they can be helped to handle matters.
The reason why I'm asking is sometimes I feel like there are children who have already proven that they are anxious about something, and because they manifest the physical behaviors and symptoms, this is not done by the parents. So sometimes you see people, let's say the people who take care of them, even going ahead to mock them. So if you're afraid of this, they literally bring you a whole chameleon to sort of scare you. And the only thing I can think of is maybe we don't know what we are doing to this child if they are indeed suffering from an anxiety disorder.
Because, okay, so one of the management is flooding, where you're just like, oh, you're scared of chameleons, shika, you know, here's the chameleon, deal with it. Though with kids, it's not really, you're supposed to just take them slowly by slowly.
Okay.
Because you tell this person, this is a chameleon, yes, why are you scared of the chameleon? Because the chameleon is, I don't know, rough. Okay, why? What happened? Find out the reasons why they are scared, and then now deal with it from there, slowly by slowly, desensitize the patient or the person,
the child,
so that they are able to slowly adapt to having this chameleon around.
I know you mentioned, I know we'll come back to the issue of how we manage this, but you mentioned something about flooding. So if you're afraid of something, we expose you to it.
There's one of the, it's not really,
proper,
it happens,
yes. Okay.
It's like swimming. I know many people are taught swimming by what? Unarusha kwa deep end. You're just like, oh, you don't know how to swim? Come, I show you something. Boom, in the water. And then you're now able to start trying to save yourself, and you know, and in the process, you learn how to swim. So now the people who it works, you know, the people it really works, and they became really good swimmers, and then the people who will never swim, like they go to Mombasa, and they can't go to the water.
Yeah.
So it's a wasted trip, right? Yeah, but you get my point now. So
I've seen a fully grown man in his 40s, let's say even in my age, who is afraid of heights. Anything above 4th floor, they're like, I can't look outside.
Yes.
And then if they see the lift moving very fast, they close their eyes.
Yes, so that one you need to go slowly by slowly.
Tumpeleke juu ya KICC?
That is flooding.
Okay.
Systematic. Maybe start 5th floor, pole pole, 6th floor, you know. But when you, because there's some flooding works, but we just like taking it slowly.
Okay.
Yes.
So before we talk about how we can treat it, what happens if we do not like address this?
So as I said, because it is affecting your day-to-day activity, your productivity in life, then that is curtailed. So, random example, if, as I said, I like music, so we'll just use people who sing, right? So musicians, maybe someone is really, really good. Like, they have this beautiful voice, they could go and things are done in the studio and produce a nice song, but she cannot leave the house. Or she cannot sing in front of crowds. So what happens? If she cannot leave the house, unless the studio is brought home, then she's not able to work. You get? Or she can go outside and do her job, but she cannot perform. So, you know, one of the revenues of our source of income is concerts. And she's not able to do that. So she's losing out. Yeah. So you end up losing on your productivity. And then that is one of the ways anxiety will affect you. Then also just day to day. Who wants to have nightmares every day, honestly? So your quality of life also goes down. And so you should seek help so that we can help you have a good life and also help others.
Okay. Remember, we asked you to call in, by the way. I think we have Sereta from Vihiga on the phone. Good morning, Sereta. How are you this morning?
Good morning. I'm fine. Thank you. And you?
Yes. Talk to us.
I'm fine. Thank you. And you? Yes. How is Dr. Priscilla?
I'm doing well. Thank you for asking.
She says she's well. Please reduce the volume of your TV. Kindly, Sereta, please reduce the volume of your TV so that we can converse.
All right. Sorry. Is that okay?
Yeah, I think it's fine. Please.
Yeah, now that's a very good talk.
Yeah.
So encouraging, because in our life, most of the people are being affected by anxiety. What I just wanted to find out is that how can we really tell that this person is going through anxiety and what should we do about it? And also another question is this, especially in our school, you find most of the children are so affected until they cannot produce. You know, they cannot be productive in their studies, in their future lives, and what have you. What are we going to do about that anxiety? Then doctor said about women going through anxieties than men. It is very, very true, because I have experienced it. And being a sociologist in our society, it becomes very, very difficult. What can we do so that we can help our people? Because at times when you need to have this personal therapist, it is very difficult, because you tell somebody you come with a fee, people will always tell you they do not have money. Now, Dr. Priscilla, what can we do so that we can help our society so that we have a very healthy society?
Okay. Thank you very much, Sereta from Vihiga. A couple of questions there. Dr. We'll start with the one about how do we tell that someone is actually having this before we even help them?
Yeah, so as I said earlier, so these worry symptoms are excessive, they are persistent, and they are affecting their day-to-day activity. That already is a problem, because when you're not able to be productive in society, when you're not able to cope with stresses, that becomes a mental illness. So now, already, when that is happening, you're like, this person, it's been happening over a period of time. Even when the triggers are not there, this person is always worrying, is always feeling like, you know, something bad is about to happen. So we should come in and help. And so how do you help the person, right? So there are different ways of managing anxiety. The symptoms, you know, nobody likes having palpitation, feeling your heartbeat is beating pretty fast. Nobody likes sweating in public. Nobody. So when the attack is happening, we give medications. Medications are short term in terms of how they manage the symptoms. So you have fast acting, which is medications that you're given to calm you down at that time. Then we give you another type of drug, the antidepressants, which now will cover you for a period of time as you start your therapy. Because at the end of the day, the therapy is what we are going to look, we are saying is like the mainstay of treatment. We cannot have you on drugs for the rest of your life. We have to tell you and help you see that whatever you're fearing or fearful about is actually can be overcome.
Okay.
Yes.
I want to assume that's for severe and that's for someone who has time to go to the shop. So what about me who's just about to go to the stage and a few minutes to it, 5 minutes to it, I'm starting to shake and to sweat? What can I do to bring myself to order, if I can use that word?
At the beginning, if it's your initial attack, of course now you'll be taught ways. You can pace around the room, you can breathe there's something we call breathing techniques, relaxing techniques. You just breathe, take a deep breath, hold it in for like 5 to 10 seconds, release it. When you do that continuously, you will now relax because you want you to be relaxed. Yeah?
I'm hoping I can use this someday.
Let's one day, like when your phone is about to be snatched. So,
yes.
Yes. So there's the breathing relaxation techniques, there's the pacing techniques. There are people who, for example, if they are supposed to talk in front of people, they pick an object and they stare into that object and just they calm themselves down and then they start.
Yeah.
That is fine. But now for someone with a disorder, at the beginning, when you realize this is an illness, yeah? So I'm saying the drugs are there to help you calm down. And then now, long term is therapy. Also that, because you can imagine maybe the disorder was diagnosed maybe when you were 17 and you're like 50. You cannot be on medication all that for anxiety. What we do, we teach you how to live life, to cope with the worry.
Okay.
Yeah.
This is a joke. I've seen this in the movies, and people go to the washrooms and they tell themselves, come on, Victor, please relax. You can do it. Does it work?
Yes.
Reassuring yourself.
Because it works with normal anxiety. As we said, being anxious is normal. You look at yourself in the mirror and you're like, I am the self-affirmation. I am the best that they could ever bring on board. This is why I'm here. I am qualified to do this thing. I am good enough. You know, self-affirmation. Then you go out there and you ace it. Okay, that's fine. But someone with a disorder, that is not working because it's something mentally you've already told yourself. You formed ideas. So part of the therapy is the cognitive behavioral therapy, where you're able now to change. We want to change you from I'm not able to do it to I can do it.
Okay.
Yes.
Before we take this call briefly, the other questions were on the cost of seeking professional help and also I think the environment in learning institutions briefly.
Okay. So for schools, we are trying to come up with something where we can also have our teachers notice because, you know, mental illness is not something that's picked easily. By the time it's picked, it's usually an extreme cause. So we want to be able to have our teachers know what's happening. They have the knowledge because it's part of the training. So we just want to amplify that so they can pick it early because they spend a lot of time with the children. And then now we now seek help for the kids through the child psychiatrist, child psychologist. Yes.
Okay. But the costs from professionals like you could be a bit high.
So we have free toll-free lines, which I really encourage Kenyans to use them. We have the 1199 for everyone run by Red Cross. We have the 719 for healthcare workers. Use them because they are free.
Okay.
Yeah, you call them, you get a professional on the other end, and you're able to help. Also, government facilities, we are really pushing to have mental health professionals in all government facilities so that you can just go there. We know government facilities are cheaper, so services will be cheaper and more accessible. Okay.
Allow me to talk to Evans from Kitale. Evans, good morning. How are you this morning?
Good morning.
Hola.
Are you catching me?
Yes, Evans.
Okay, so I think this topic is a bit educative, and I think I'm a victim of the same.
Okay.
At my age, at 30, I'm still struggling with the same, and I think I'm learning a lot. In fact, I was supposed to report the job by 7:30, but already I'm late because I follow it. So, my question is...
Thank you for watching.
Does it have any genetic... Can it be passed from generation to generation through genes?
Okay. Okay.
Or it's something that just occurs according to or through situations that happens in life.
All right. Thank you, Evans. We will try to respond to your question just shortly. That is Evans from Kitale. I think it's a question that you've already responded to, but for the benefit of Evans and others who maybe missed it, just respond to it on the issues of genetics.
So as we said, yes, there's a risk. With mental illness, you say the risk. There's a risk that your first-degree relatives will maybe get the disorder when you're diagnosed. It does not mean they will get it. It just means it increases their risk of getting it. Also, another thing I forgot to mention is one of the risks is there are some diseases that will manifest with things like thyroid disorders. They'll give the body a similar reaction to anxiety disorder. So always get checked to make sure that your body, your other organs are working correctly and working well,
Yeah.
so that now you don't be given a diagnosis of anxiety disorder yet. Maybe you have a thyroid disease that's giving you an illness.
Okay.
So the risk is there, but it doesn't mean they're going to get it.
Okay. There was an issue about depression and issues like stress. Is there any connection?
So what happens when you worry? You can worry a lot, and then you end up, it affects your mood. You get mood symptoms, so you become super sad. Then now you start having the signs and symptoms of depression, which will be, you'll be sad, your sleep is affected, you don't want to work, you have reduced concentration. When you're working, you may be suicidal. So the risk of depression is also there. And for a depressive diagnosis to be made, it will take around 2 weeks of feeling this low mood for around 2 weeks. And then that one, you seek immediate care.
Okay. Yes. Before we continue the issue of treatment, I think we also have Levi who wants to talk to us this morning. Good morning, Levi. How are you this morning?
I'm fine, thank you.
Yes. What's your question or comment for our conversation this morning?
Okay, I want to thank you because of the program, and I want to say thank you very much. My question is, I was involved in a road accident.
Okay.
And I wanted to Dr. Priscilla to help me to know if this is anxiety and how do I go about it.
Okay. Okay.
It's like I'm still in very deep pain.
Yeah.
And like when I see a vehicle, I don't want to go to the road, tarmac road. I don't want to drive. I want to go to the same route where I was involved in a road accident.
Okay.
And this was on 11th this month.
Yeah.
And on 13th, my sister died in a hospital.
Okay.
Then after parallel, when I went to be treated, I went to the same hospital. So like I was unable to go to enter the rooms where I was to be treated. I don't know. I don't want to enter those rooms, and I'm still paining. I don't know what to do. The pains are not relenting.
Okay.
So, Dr. Priscilla, please help me. How do I go about this? Because the doctors have tried, but the pains are still there. I don't want to go to the road. I don't want to go to hospital. I don't want to move there and there. And I don't know where I am.
Okay. Thank you, Levi. Thank you, Levi, and Paul, of course, for what you've gone through. We wish you a quick recovery. And Dr. clearly, the 12th of this month, the memories are still fresh. Just talk to him.
So for him, first of all, pole sana for the loss of the sister, and also for the accident that he had gone through. That was number one. Number two, I would really wish for him to have now a proper checkup with a psychologist, because it's this month, so the time frame doesn't. It's a short. The body is reacting to the grief and the accident. It's trying to process it. So before we rule out anything, the reaction is within normal range.
Okay.
But we want him to get seen so that we can rule out, are there other things? Does he have the risk factors? And now how can we manage? So he's in, he said he's...
Malava.
Okay.
Yeah.
The nearest, we usually have clinical psychologists or nurses who've done psychology or mental health.
Yeah.
Anyone trained in mental health around there. So the doctors there should refer him to a mental health specialist in the facility.
Yeah.
And they'll get proper assessment. Or if not, he can call 1199.
Yeah.
That's a toll-free number.
Yeah. That Malava is actually in Kakamega County.
Yes, Kakamega County has specialists. The nurses, you have nurses who are trained in mental health, clinical officers who are trained in mental health. The general hospital actually has a psychiatrist. It has a mental health unit, so he can get seen there. But immediate, he can call 1199. They'll do phone telemedicine. It's something we're really introducing into the country.
Yeah.
It's something that works. So just call in 1199. I don't know how many times I'll repeat that number.
Okay.
So that he can get help
Yeah.
immediately, and then now from there they'll guide him on the steps.
Yeah.
Then he can go get seen by a professional at the health facility, so that we can now properly assess the patient.
Okay. I want to take Alex from Busia, but before I do it, if my director's name is Arnold, if he notices a few minutes to the show that I'm sweating and I'm losing it completely, what can he do to help me? What can you do as a third party to help someone that you've noticed has a problem?
So breathing, that works. Self-affirmation. So just give the person time.
Yeah.
Just give them time to orient themselves with their new place.
Yeah.
They relax. Help them relax. Whatever relaxing techniques they have. Maybe you'll notice the people who do softballs. give them that softball and just don't make noise at them. They're getting, no, they are reorganizing themselves. By the time you're noticing that someone is having an anxiety attack or panic attack, actually that person knows. They've been trying to hide it from you, but now you've seen. So help them, just give them time, help them breathe, calm them down, and then they will be able to take up their role.
Okay. All right. Let's take this one final call. This is Ernest, I believe, from Busia. Good morning, Ernest. How are you this morning?
Good morning.
Yes. Do you have a question or a comment for us?
Yes, I have a question.
Yeah.
I have been taking the drug for the last 5 years.
Yes, Ernest.
I was in campus.
Yeah.
And I finished campus, and it has become hard for me to access the drug.
Okay.
When I was in campus, I was a psychiatrist who used to write the drug, but now when you're outside, so I know the drugs I think very hard to access them. Like now I'm in Busia.
Yeah.
Those drugs are not in Busia.
Okay.
You must get them in, maybe let's say in Nairobi.
Yeah.
With a prescription.
Okay.
And this therapy, I've heard the doctor talk about where are the therapies and how much they cost.
Yeah.
Yes. Because for me, I really want to deal with these anxiety-related issues.
Okay.
Yes.
Thank you, Ernest. And I believe he's talking about drugs for managing anxiety?
I hope so. I think at the beginning I had antidepressants. I don't know if it's a depression or not. So generally, because I'm not going to do specific, I'm not assess the patient. Yeah. But one, if the patient is, as he says, is on medication, so the nearest, I'm big on go to your nearest facility. Yeah. We might not, what happens in Nairobi, we have a lot of access to different types of medication. Okay. When you go to the rural areas or the outflank counties, that becomes a problem. Okay. It doesn't mean you have to take, like we look at, there's the trade name and the drug itself. Okay. So if he needs an antidepressant, doesn't mean he has to take the specific one. Since you're on medication already and you have to be compliant, you will take the drug. Most of our facilities have the basic drugs. Okay. They are offered. All right. So if he goes to the facility, you'll be offered. Public facilities, we are really pushing to have decentralization of mental health care. So we have professionals coming into the county slowly, but they're coming. Okay. Yes. All right. We have to leave it there. 30 seconds for your closing remarks, please. Okay. Another big thing that we need to be doing to maintain our mental health is physical activity. So we have an activity on Saturday, actually. We are having cycling for mental health at Madare Hospital at 6 a.m. Kindly come, let us cycle our way. It's 18 kilometers from Madare to TRM and back. So let's pattern Saturday morning. Okay. Before we go, let's get to sample some of the feedback you've been sending us on social media. If we can get a few very quickly. Yes, remember we asked you, have you ever experienced an anxiety attack? What did you do to calm yourself down? This is what some of you are saying. Joshua Dada says anxiety is prone to not only the elderly, but also young people. It's one of the problems facing a majority, even though health specialists claim that they are underway in solving the challenge. People are facing mental torture, while others die out of the problem. Thank you. Captain Morgan says, it's messed me up, damaged me, and I made someone hate me. It's now 6 years, and she still hates me. Thank you for your, of course, feedback, and we wish you well. Michael Angaya says, my dad confessed to me that he even didn't know why he is anxious, but it was driving him to commit suicide. Pole sana, Michael, and thank you for your feedback. We have Kituku who says, deep breaths and avoid resisting present moments. Thank you, Kituku. Yes, we have more. Dennis Moasia says, I took much more water, break, and slowly went to bed. I hope it worked for you, Dennis, and I hope it works for all of you who are suffering from various forms of anxiety. We wish you well. We hope this session has been helpful for you. Many thanks to my guest this morning, Dr. Priscilla Macau, psychiatry resident at the Mathare National and Teaching Referral Hospital. We have to go for a quick break, but when we come back, it's World Heart Day as well, so we'll talk about the burden of heart diseases in Kenya. Don't go too far.